This is Radio Health Journal. I'm Reed Pence. This week, a visit to the COVID front lines.
You never know if this could be the exposure that could make you ill, that could kill you. And we have to be mindful of that every day. So we have to prepare ourselves. We have to gown up.
How frontline staffers in the ER and ICU are holding up when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
So upon first looking at the programs, parents are oftentimes and understandably tricked into believing this is a safe environment, but what goes on beyond those doors is a far different story.
The darker side of inpatient youth rehabilitation. Then,
it was a real struggle for investigators before they were able to team up with forensic scientists.
The birth of the American CSI. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Every day, 2 or 3 or even 4,000 Americans die of COVID-19. Many more find their way to emergency rooms and ICUs in serious distress. Often, their families are not allowed to see them, even as they lay dying. Only the nurses and doctors who take care of them are present, trying to help them make it through the crisis and comfort them and their families if time is short.
I don't think there's anything more stressful than having a loved one seriously ill, and because hospitals have policies preventing visitors, not being able to be there when the serious illness strikes for a loved one.
That's Dr. Christopher Michos, an emergency medicine physician at Norwalk Hospital in Norwalk, Connecticut.
We all feel this pain. We all feel the tension and how tough it is, and it'll linger for some time afterwards.
Patients that pass away in the hospital, and we do our best to not let them die alone, have someone in the room, sometimes holding their hand, but just being present so that, and often being able to have even a video of family to at least see their loved one and say goodbye while they're in that state and isolated. You know, it breaks our hearts to deny family members from being able to come in, but, you know, we have to do what's right for everybody else.
But Dr. Gabriel Lockhart, director of the ICU at St. Joseph Hospital in Denver and assistant professor of medicine at National Jewish Health, says that's just one of the sources of mental exhaustion for frontline workers. Perhaps a bigger factor is that it's dragged on and on, 11 months now, and no end in sight.
The first thoughts of how I've been feeling is, exhaustion, whether that's physical, emotional, mental fatigue that's, transitioning, the longer we've been into it, into a sense of numbing sensation. It's something that we've had to use as a self-defense mechanism just to keep going in and day out. It's almost like Groundhog's Day for us as this pandemic is dragged on.
Another factor leading to mental exhaustion, Michos says, is the constant danger.
It's always in the back of your mind that you may be exposed to COVID or a colleague may be exposed to COVID. You never know if a patient could be COVID positive. You never know if this could be the exposure that could make you ill, that could kill you. And we have to be mindful of that every day. So we have to prepare ourselves. We have to gown up. It's being very vigilant. Any potential patient could be COVID positive. I've had patients with maybe an orthopedic injury or a cardiac issue or a stroke, and as part of the routine testing, you do COVID. They have no respiratory symptoms, nothing to suggest it's COVID, and the COVID test comes back positive. And I thank my lucky stars that I wore my gown, that I wore my mask, that I had my face shield on, because you have to be vigilant across the board.
But those precautions have created yet another stress point for frontliners. Michos says doctors and nurses can't possibly have the connection with patients that they normally do.
It's very hard to be connected when you're in a impermeable gown, when you're gowned up in gloves and you're gowned up in a mask and a shield and headgear. And sometimes it mimics what astronauts would wear as a moon suit with ventilator equipment on your back. We've lost that ability to be up front and next to our patients, being able to hold hands or being able to provide a smile. That to me is so difficult, and I hope people and patients can recognize maybe my facial expression through my eyes, but a smile can't be visualized through a mask and a face shield, or a laughter is muted because of this equipment. So that connection is lost, and part of the reason we like doing what we do is because of our connection. So that's been a challenge too.
But while frontliners may get frustrated with all the precautions they have to take, Lockhart says he and other healthcare workers also get frustrated with those who don't take precautions, those who still don't mask up, and add to the number of those who get sick.
Certainly contributing to our exhaustion of the month is fighting the fight two fronts, one in the hospitals and the front lines of healthcare systems against the actual virus itself, but then we're also fighting misinformation about media and internet, social websites, and then the spread of or kind of leading the wrong sources. And that honestly has been equally as exhausting as the fight itself against COVID. And it's unfortunate, there's already so much that's on our plate, and to have to battle that in our free time is really overwhelming.
However, mask deniers still get treated. And in some ways, Maiko says it's a little like what he sees every day in the ER, patients whose habits put them more at risk.
We have a job to do, and that's to care for patients. And we deal with all sorts of patients. We deal with patients that maybe drink too much or take drugs or don't take care of themselves or don't adhere to a good lifestyle. But we don't wave our moral compass at them. We care for them. And that's where we're going to be, whether patients don't adhere to social guidelines and social distancing or don't wear their masks or have a political view. We're blind to that in our emergency department. And I think, again, that also makes up our DNA as physicians and as healthcare workers in the emergency department setting. We don't refuse patients. We never have. Granted, there's a Fed law that prevents that. But I think we have our moral compass where anybody that walks through the door, regardless whether it's a political belief involving COVID or any other type of belief, we're going to care for them.
Lockhart says the exhaustion, grief, and stress show up in a lot of little ways. He feels it himself, despite his best efforts.
We try to take the small victories when we can, but they're few and far between. There's been definitely changes that I've seen in myself. I'm a pretty relaxed, easygoing person at baseline with a cool, calm, collected nature. And despite being in the ICU for most of my career, I'm still able to kind of balance myself and take that with me in a job. With how things have transpired over the last 10 months, I've noticed in myself, and I've become a little more bitter and a little less patient, less myself as this has come along. And I have to occasionally check myself to make sure that I don't take out my exhaustion out on anybody else, because at the end of the day, before it's burned out, as a lot of us feel, especially holidays, wishing you weren't at work. It doesn't take me long to bump into someone that has it way worse than I do.
That puts things in perspective for him and gives him energy to keep going. But Lockhart and Maikos agree, for some frontline workers, the pressure has been too much, and they've left healthcare.
After the first round, when a lot of the nursing staff and physician staff, frontline workers, were very, very worn down, and a lot of them left the profession or left the front lines because they didn't want to deal with the looming second round that we knew was coming and was potentially going to be worse than the first round.
Maiko says one thing that's kept him going is the nature of the work in the ER. He's working long hours, but knows each day has a limit.
I know it's going to end, fortunately, because the beauty of emergency medicine is shift medicine. While the shift may, unfortunately, is lasting longer than it normally has, I know that I can recharge. I can go home. Certainly my ICU colleagues might have to extend and spend longer times. Hospitalists work longer, too, caring for the patients. So we have shifts medicine, but we have to be available in case somebody else calls out sick. We've had nurses come down with COVID, and we've had to replace them. Yes, it's tiring, and it sometimes can be brutal. It's affected me, and when is it going to end? You ask the question. are we going to get hit with another wave? But it's just the strength and energy that we resolve and we get it done.
And while Maiko says his hospital has been good with setting up support lines and groups to help staff when things get too stressful, it's the mutual support within his team that helps most, so frontliners can hold it all together.
A lot of discussion about The Crown on Netflix or what we've been watching on Netflix. So during our downtime, our staff is still engaged. They're engaged with friends, they're engaged with colleagues, they're engaged with family. There can be times when the challenges get too great, and we try to support each other. As I said, Netflix has become a hot topic, or what did you watch on Amazon Prime, or have you seen a movie, or are you watching a good series? A couple of us are sharing bourbon recommendations and what we like, having a good glass of bourbon at the end of the day to relax, so we share our recommendations on that. People are finding ways to cope.
Unfortunately, some have never found ways. But Lockhart says that's not unique to healthcare. The stress of the pandemic has created COVID victims throughout the population in other ways.
We had a high amount of suicide rates and alcoholics that came in on a binge and dying from drinking themselves to death, essentially. The human resolve, it doesn't do well in facing adversity with no known end in sight. So you have to kind of break it up with small, achievable goals throughout the day, throughout the week, throughout the month. You have to find small victories. And you have to be able to, little things here and there where if you have to make it to the weekend, you have to treat yourself right on the weekend, or if it's just getting home from a shift and watching a football game, or having a lot of excitement about the vaccine and maybe that providing a potential end to all this. But you have to find something that, gives you some achievable that keeps you going.
Recently, the biggest thing that keeps frontliners going is the vaccine.
The minute that vaccine came out, I got hundreds of notifications of pictures of emergency medicine physicians and personnel, healthcare personnel, signing up and getting their first and second shot. In fact, when it became available in our institution, I think I was the third one to sign up.
So much joy. It was the vast majority of us in the front lines when we heard vaccine had been authorized by the FDA. This provided a first tangible means to an end, where we're still far away from getting over this. There's still many things that need to happen, but for the first time, we saw the light at the end of the tunnel.
Without the promise of the vaccine, who knows how long frontliners could keep going? It's likely many more would drop out. But with the vaccine, they know that they'll be safe and that someday this will all be over. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence. Coming up next week on Radio Health Journal.
What we did see are these kind of drag racing opportunities where we would see drivers speed through cities like they're in a video game.
How the pandemic has changed the way we drive.
Then vaccine passports, your ticket to getting back to normal without easily forged paper passes.
A flight departing from Moscow to China, where they grounded the flight because they realized that 200 passengers had produced the same negative COVID test certificate.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.